Hi there, my name is Anna DeLobo. I'm a licensed acupuncturist, and today I'm going to read from PubMed regarding some studies that are positive in regards to acupuncture, real acupuncture, not sham acupuncture, and some specific health issues. So I'm going to read directly from my websites that I've copied and pasted them on. If you go to elementsinharmonyacupuncture.com and you go on for patients and you scroll down, you'll see that there's a research newsletter. So far, and this is going to be an ongoing project that I'll be doing. So far, I've posted on my first research newsletter 4 studies that are from PubMed: allergic rhinitis, endometriosis, obesity, and post-operative pain. So these are all cited. The links go directly to PubMed. So if you go to elementsinharmonyacupuncture.com/research-allergic-rhinitis, you'll see research and it's underlined. So if you click on that, it'll take you directly to the pubmed.gov page. And the title of the article is Acupuncture and Allergic Rhinitis. It's by Malcolm B. Taw, William D. Reddy, Folashade S. Omole, I hope I pronounced that correctly, and Michael D. Seidman. So you can read the abstract and the recent findings and everything there, but I just copied and pasted something specifically regarding that study onto my actual website. So I'll just read directly from here. Recent findings are a review of the medical literature from January 2013 through December 2014 reveal that there is research demonstrating efficacy and effectiveness for acupuncture in the treatment of allergic rhinitis, as well as improvement of quality of life and quality adjusted life years. Summary: there are high quality randomized control trials that demonstrate efficacy and effectiveness for acupuncture in the treatment of both seasonal and perennial allergic rhinitis. Smaller head-to-head studies also show some preliminary benefit of acupuncture when compared with antihistamines. So you can go to pubmed.ncbi.nlm.nih.gov/25943,957. I was a little tongue-tied there. So that is the study regarding one of the studies that I was able to find regarding acupuncture and rhinitis. So the newsletter that what else have I posted? And I just posted this last night just to give you a reason why I'm doing this. This is my 23rd year in practice, and there are some medical doctors who are very much for Chinese medicine and acupuncture. They understand that Western medicine is not necessarily the end-all of Western medicine, and I, being a seasoned acupuncturist, I'm board certified, I can tell you Chinese medicine is not the end-all when it comes to helping people live higher quality lives. This works, in my opinion, having been practiced since 1999, it is now 2022. This can help 90+% of the population. Will it help 100%? I have not found that to be the case, but easily 90 to 95% of the time, I will get some results, and in many cases, I'll get excellent results. Now, I shared that there are some doctors who are really for integrating the medicines. I've been studying Chinese medicine since 1994, and I've seen the texture of our medicine, those of us who practice Eastern medicine. I've seen the texture of Chinese medicine evolve over the decades. Unfortunately, there are still some Western medical doctors who are vehemently against Chinese medicine, and I won't share my opinions about that, but I will say that not all the studies out there are negative. So I am scouring the internet for, especially on government websites, to show the positivity of Chinese medicine in people's lives. I have dedicated a huge portion of my life. I'm 48 years old. I started studying Chinese medicine when I was 20. So a great 28 years of my life, I've been committing my energy towards showing what Chinese medicine can do. And in the last 23 years, I've been able to work in this profession. Now, I started being on social media in 2006. That's when I believe I started going on YouTube. My videos aren't fancy. They're just data. They're just a lot of times, not just opinions, but testimonials from my patients. I'm just giving straightforward information because this is how I was coached. Show the work, show the testimonials. Don't just give opinions. Give actual data here in my practice. So now I'm taking it to the next level and showing you what is on some government websites. So because I've been told by some of my patients how some of their doctors are not in agreement with them choosing to see acupuncture and take Chinese herbs. And this really hurts the feelings of some of my patients. And unfortunately, this drives, truth be told, a lot of my patients to go seek other Western medical doctors who will be more supportive and have more kind bedside manners. I always tell my patients and clients, I work for you. And I have Kaiser. I know what it's like to be in a big Western medical hospital. But when it comes day in and day out for my children's health care, I oftentimes pay out of pocket to see physicians outside of Kaiser because oftentimes they're smaller and I can have a longer conversation with them. They understand that I practice Eastern medicine and they're open, and oftentimes they practice integrative medicine. They have their medical license as well as other types of degrees that show their commitment to understanding the person as a whole, understanding diet, understanding supplements, understanding that maybe what they know in Western medicine may not be completely comprehensive for the needs of the patient. Same thing with me. If I cannot deliver everything I can to the patient, I definitely will refer them to Western medical doctors, chiropractors, naturopaths, physical therapists, and other types of healers and, doctors and therapists in other fields that are much more equipped to help the patient, the client, because that's what matters the most. So having shared that, the next study is research. Systematic review and meta-analysis of complementary treatments for women with symptomatic endometriosis. So you can find this at elementinharmonyacupuncture.com/research-endometriosis. Click on systematic review and meta-analysis and it'll take you directly to the pubmed.gov website. That's pubmed.ncbi.nlm.nih.gov/299444729. So what does it say? Main results. The complementary interventions studied were acupuncture, exercise, electrotherapy, and yoga. All were inconclusive in affirming benefit, but demonstrated a positive trend in the treatment of symptoms of endometriosis. Meta-analysis of acupuncture showed a significant benefit in pain reduction as compared with placebo. P equals 0.007. Those of you who are statisticians, that means something to you. Conclusions. Numerous complementary treatments have been used to alleviate the symptoms of endometriosis, but only acupuncture has demonstrated a significant improvement in outcomes. Very important data. By the way, with the P equals 0.007, that is very important. We want to make sure that that statistic is around that number. So I won't go into detail here. This article was written by Tiziana A. Mira, Mariana M. Buen, Murillo G. Borges, Daniela A. Yella, Christina L. Benetti Pinto. And so I think that is I just did a video on endometriosis. I just received a testimonial regarding stage 4 endometriosis. You can check those out on my website. So the other two are research and obesity. And if you go to elementsinharmonyacupuncture.com/research-obesity, if you click on acupuncture versus sham acupuncture for simple obesity, a systematic review and meta-analysis, it'll take you to pubmed.ncbi.nlm.nih.gov/320151189. So the part that I simply quoted was, the review suggests that acupuncture is an effective therapy for simple obesity rather than a placebo effect. And the authors are Yumei Zhong. I'll just give the last names: Luo, Chen, Lai, Liu, Sheng, Zhang, and Zhou. I apologize if I did not pronounce those names correctly. This is very important. Systematic reviews and meta-analyses are basically the highest levels of studies. So when you see that, you want to pay attention to that. When you see something around P equals 0.005 or around that number, that's very, very important. And you could do your own research why. I just want to pay attention in this video to the actual quotes I'm extracting from the studies. Then the next one, I will say that from 1994 to 1996, I lost 48 pounds. So I can tell you acupuncture and Chinese herbs does help. I was able to walk at a size 0-2 for many, many years, up until I had my third baby. So I'm hovering around a size 4. I really want to walk around at a size 2. I'm being gentle with myself. I'm 48. I think I still look good. I've had some surgeries in my life, and it's a little difficult to lose certain pounds, but I'm only at, like, if I had it my way, around 5 to 8 pounds of what I want to lose. So I'm not going to kill myself to lose those last few pounds. I feel like I'm strong, I feel like I'm healthy, and I feel like in many ways I look great. So I'm grateful for my capabilities physically, emotionally, and mentally, and I'm no longer at that place where I was walking with much bigger clothes and feeling sorry for myself. So obesity is not something I currently deal with, but I did in my late teens, but especially, my late teens, because I started losing weight when I was 20, and I started receiving acupuncture. That is a long conversation. Maybe, I think I've done a video on it, and I can talk to you about it personally, which I have. So my next study, and the final study for this particular video, is research post-operative, the efficacy of acupuncture in post-operative pain management, a systematic review and meta-analysis. So again, when you see systematic review and a meta-analysis, you know it's a high-quality study. Conclusion: our findings indicate that certain modes of acupuncture improved post-operative pain on the first day after surgery and reduced opioid use. Our findings support the use of acupuncture as adjuvant therapy and treating post-operative pain. If you click on a systematic review and meta-analysis on that particular page, it'll take you to the actual article at pubmed.ncbi.nlm.nih.gov/269-59661. I'll just give the last names to quote them: Wu, Chen, Huang, Zheng, Ye, Li, Lin, and Chen. And I think that's a very important article to read. Those are 4 studies that, should definitely convince you that there is efficacy and legitimacy in people seeking out acupuncture. Specifically, in this case, it's acupuncture. I will share this. I've treated my share of patients and clients severely addicted to opiates, and I have found acupuncture to be very effective. Please do watch my accountability video. Please do watch my expectations video. This is not going to happen overnight. It takes time. When I was in Chinese medical school for my master's, I'm currently getting my doctorate. I'm in my last semester beginning May, and then I will have my doctorate in acupuncture and Chinese medicine. In 1998, when I graduated from my master's, around that year, the last 2 years, I worked at a community medical, and I worked at a homeless shelter as an intern, and I was able to significantly make an impact positively on people who are addicted to heroin, crack cocaine, and other types of really hard drugs. And I was very grateful and very humbled to see what acupuncture specifically can do with people with addictions. I myself had suffered from food addictions, and I don't have food addictions anymore. I can control myself easily. I don't even have to think about it. I eat, I get full, and I'm done. It wasn't like that for me before because I had a little bit of lack of control. So I believe with my own findings clinically in my practice that I've been able to help people suffering from addictions to alcohol, all types of drugs, many types of drugs, nicotine, and food, and other types of behavioral issues. So I've also been able to help people reduce their intake or eradicate their need of opiates. And that made many people happy because that's not a life that they wanted to continue living. You can check out my work at elementsinharmonyacupuncture.com, and you can call my office landline at 949-305-1703, or you can text me on my work cell phone at 619-341-4341. Thank you.